This is a tutorial on peer review. Peer review is included in the portfolio because you will be required to complete at least one every 3 years as part of your registration. Peer review also provides an opportunity for feedback with another voice. However, peer review is only useful if both parties actively and honestly participate and if some preparation is done beforehand. For the purpose of peer review, the person who is being reviewed, who is being observed, is the reviewee, and the person who is observing is the reviewer. The peer review that goes in your portfolio is the one that is done on you, the one where you were practicing and being observed. You need to prepare and plan your peer review. You need to select 3 performance indicators where your practice will be most closely observed. We would expect that you would choose performance indicators that you are working on, something from your professional learning and development plan, or something where your supervisor has identified to you that it is an area that needs improvement. And this is how you justify your selection. It's very important that you plan ahead because you will need to make sure that the agreed performance indicators that you want to be observed will be available for the patient that you've selected. For example, if you want to have your initial assessment or subjective skills to be assessed, then it may not be that a follow-up patient in their final treatment is the appropriate choice. We recommend that you plan for and prepare for your peer review to be early on in the placement. Prior to the session with the patient, you need to make sure that this is completed, that the reviewee has communicated to the reviewer what the performance indicators are so they can take special note of them. After the session with the patient, a self-reflection is completed by the reviewee. These are the performance indicators and they identify strengths and areas for improvement. There's a section for anything else that's come up that's really important in the session that doesn't align with the performance indicators. The reviewer does the same. They document their observations of strengths and areas for further development in alignment with the performance indicator selected and anything additional that they felt was very important to feedback on. In the final element of the peer review, there is a discussion where the observation and the reflection are compared. Areas for further development are prioritised and identified here, and learning strategies, how these areas can be improved, are problem solved between the two peers. This is a portfolio mark sheet. The elements, the objectives of the portfolio that are looked at in the peer review are assess own performance, identify areas for improvement in response to feedback, plan learning and development, and an element of professional behaviour in documentation and task completion. What we're really looking to see is, are you linking one element of the portfolio with another? Do your choices make sense? Have you planned them? And are you prepared? Are you aligned? Is your feedback aligned between the observations and the reflections? In the portfolio guidelines that are on Blackboard, you'll find an example of a completed peer review so that you can see some examples of what we might expect to see. As with the Professional Learning and Development Plan, the APP and the APP strategy document might also help you to identify performance indicators to improve on and learning strategies. Usually, the only issues that students have with peer review are lack of planning and lack of time and organisation. So if you make sure that these things are organised well in advance and given some thought, then there should not be a problem. and hopefully you'll find the feedback a useful resource to help you to prioritise and plan your learning.